on the floor, but there are a couple things that I would like to make clear to myself, and either one of you are welcome to answer. It's be fine with me. Now, what I'm concerned about is, you know, I just will listen to economists and policymakers. It's just a habit I've had all my life. Most of them are saying that there really is very little deficit reduction here, but an awful lot of pain and numbers of jobs to be lost. So in that regard, I want to really understand the Medicare issue. As I understood what the President said, and I did understand what the President said quite clearly, was it could cost each senior citizen, this plan, $6,000 a year more in Medicare costs. I've been concerned enough with the notion that a lot of people who are, as Mr. Sessions mentioned, people who are physically, mentally, in other words, unable to go into the private insurance market, it's going to have a devastating effect on their lives, and I think on all of ours. I think the disruption to seniors who are on Medicaid when the block grant runs out in states are going to find themselves out into the street. Anyway, I'm not going to go on this. I just simply want to, do you agree with the President that this would be a devastating thing on seniors and that no state that I know of or hospital believes that they can live with this portion?
And I thank the gentlelady from New York and the ranking member. As a physician, this part of this budget is particularly poignant and important to me. What I see and what folks who are objective about the Medicare system right now will see, if they're honest, is that we have a system going broke. The Medicare trustees say that. In 9 years, the system implodes because of the number of retirees, the baby boomers, coming into the system and the lack of resources available for it. So for those, if you're satisfied with the status quo, for those below the age of 55, 56, they won't have a Medicare system in place. In fact, the President's speech today outlined what his plan was, and that was to empower the individuals who will decrease the services available in Medicare. So what we do is actually preserve Medicare for those currently in the system and in or near retirement. And for those below the age of 55, we actually save Medicare, and save it in a way that probably most of us have talked about, and that is by saying that don't you think it would be appropriate for members of our American population to have available to them a system that's just like those members of Congress, Federal Employee Health Benefit Program.
If I could just, I don't want to take a lot of time because we don't have a lot of time, and but is this voucher going to cover the cost of that private health insurance?
Well, with all due respect, there is no voucher. And a voucher is something that the
what
government
is the plan for the voucher?
There is no voucher. The government, a voucher system is where the government takes...
They do not have to go into the public market themselves?
If I may respond.
Yes.
A voucher is when the government takes a certain amount of money and provides it to an individual, and then the individual goes into the public market and purchases whatever service they desire. What we propose is a premium support, which is essentially what the Federal Employee Health Benefits Program is, and that is that the individual selects a health coverage policy that's correct for them, and then the resources go from the federal government to the plan itself. And so it's not a voucher program at all.
Well, Dr. Price, I don't know what we could call it anything in the world. What we're saying is that we are sending senior citizens out in the public market on their own to buy health insurance.
Not at all. What we're doing is saying that we guarantee and save the Medicare program for those in future generations.
In private insurance plans.
What we do is guarantee a health care coverage system.
There is no reason to believe that those
seniors.
costs won't go up. And on the Medicaid system, which is being block granted to the states, if that does not cover the cost of Medicaid in that state, or population shifts, or heaven forbid we go through another awful thing we've gone through with unemployment, what happens to them?
Well, again, as a physician, I can tell you that the Medicaid population is extremely important to me. And when I worked for 20 years as a physician and took care of Medicaid patients, I understand the importance of the viability of this program. And what our budget does is saves the Medicaid program in the same way that a Democrat president and Republican Congress in the 90s saved the welfare program. And that is through block granting to the states to give the states greater flexibility to be able to cover their indigent population. Because what's right in New York may not be right in Georgia or may not be right in California. States are different, and the manner in which they're best able to provide health coverage and health services for their indigent population, it may be significantly different.
Every economist that I've heard and everybody else that I've heard speak about talks about unspeakable damage to Medicare and Medicaid, which heavens knows are Democrat programs. We feel pretty good about those. We think that they've saved a lot of lives of people who couldn't have gotten help. But this is not a committee that deals with saving of lives.
Well, we'll get you the list of economists who would disagree with that statement.
Well, perhaps, but I don't, and I'm rather broadly read, but also I want to know about the taxes. You say you don't raise any. Is that right, on the middle income?
Correct.
Not at all. And you plan to do all this plus while taking from seniors, because I do believe that that's what's happening here, and the poor. You're pretty lavish with corporations and America's richest families. I would love to see the corporate taxes changed, but that's not happening in this budget.
On the contrary, it is.
At the same time, you're calling for shared sacrifice.
Well,
you really are not asking anybody to sacrifice who's well off and who could afford to do it. This is a hit on the middle class and the low income in this country.
Well, I would respectfully disagree. And in fact, we do address the issue of corporate taxes, business tax rates, because we have the highest corporate business tax rate in the industrialized world right now, and we believe it ought to be decreased to 25%. So that we are competitive in the world.
Well, what I think is that they need to pay their fair share, and that I don't want to get caught up again in an AMT, alternative minimum tax, which snared tons of people who should not have been in it. But the fact that corporations, Texaco, General Electric, and others pay no taxes at all is offensive to most people in the country. Sure. Do you agree with that?
But we think they ought to pay their fair share, but right now their fair share is not competitive in the world. But what you're going to do to give them their
fair share is to reduce the corporate rate 10 points.
Well, if they're paying nothing now, then they're not paying the rate that's currently prescribed for them. So what we do, well, listen, let me just end by saying this. I haven't heard a word from Mr. Van Hollen. I hope he's going to give me one. We have a Pulitzer Prize winner in Rochester, David K. Johnston. He's a great economist. He wrote tax reports for the New York Times for decades, and he has recently done the census numbers and found that tax cuts have done nothing to spur the economy, done nothing to generate significant job growth or to grow federal revenues. Mr. Van Hollen alluded to what the Heritage Foundation had told us, how great it was going to be in the Bush administration, that all these jobs are going to be created, and what we saw was absolutely the opposite. Why do you think that won't happen this time? Well, I'll tell you why I don't think it happened, because that's not what happened.
Yes, it is.
In fact, what happened is that the job growth following the 01 and the 03 tax reductions in the Bush administration were nearly 8 million new jobs. Now, what happened when we came to the summer of 2008 and the fall of 2008 were significant challenges to the financial system. There's no doubt about it.
We lost a lot of jobs, Dr. Price.
8 million new jobs created up before the summer of 2008.
That does not jibe. I know that when Mr. Sessions
we'll be glad to get you those
well
numbers.
On our way in this country to not only getting rid of the deficit, but starting on the debt. We were well on our way into that during the Clinton administration. But I really am afraid that what you are talking about putting here today, and everything that I know about it, and everything that I've read about it, I don't see it creating the kinds of jobs. As a matter of fact, we've been in session 99 days today. And frankly, we've not created a single job in the Congress of the United States, except for the people who work with us, or certainly no jobs in the country. We've had no job bill here, and I don't believe this is one either. Mr. Van Hollen, do you have any comment you'd like to make about how many jobs are created because we paid no taxes?
I do, Ms. Slaughter, as you indicated very clearly. During the Clinton administration, when we had somewhat higher tax rates, especially on people who make a whole lot of money, top 2%, the economy was roaring. In fact, David can say during the early part of the Bush administration, after those tax cuts, 8 million jobs were created before it then went and crashed. During the Clinton administration, 20 million jobs were created. Economic growth was roaring. The point isn't that higher tax rates create jobs. The point is that people who are producing jobs in this economy, that is not the main driver of what makes businesses go. And it is just ahistorical and counterfactual to say that that is what happened. It's a version of trickle-down economics. It was discredited early on, and the last 8 years of 2000, 2008 put an end to the trickle-down economics theory from any objective perspective. Let me say with respect to the tax rates, because this has come up again, and I have to distinguish between the corporate tax system and the individual tax system. The corporate tax system is a relatively small part of the revenue. It definitely needs reform. We call for reform of the corporate tax system in our proposal. There are some things, as I said earlier, we could do right away, like getting rid of some of the subsidies for big oil companies. We don't really need to study that problem. But yeah, we need to do that, and you can do that in a way to deal on the base and deal with the rates. Individual income taxes is what they also say they're going to reduce by 30% for folks at the top. And I'm looking forward to seeing the proposal that does that without raising taxes on middle-income Americans. We had a vote. We had an amendment in the Budget Committee that said, let's not do that by transferring the burden to the middle-income papers, and it was a party-line vote. I want to say one thing about this Medicare system. Under this plan, seniors will not be able to go into Medicare anymore. It requires you to go into the private health insurance market, where costs are rising very rapidly. What we need to deal with in the healthcare system is bring down costs in the whole system, not transfer all that risk and all that cost onto seniors. The president was absolutely right. It will increase the cost to a senior by $6,400 early on. And the reason that happens is they can call it whatever they want. But the guy Henry Aaron was the person who first came up with the premium support system. The idea was you get support for the premium. I'm sorry you weren't here earlier, David, but the fact is that this Medicare termination proposal does not give. Well, you can call it what you want. All right, fine.
Yeah, you can call it what you want.
Okay, you get rid of Medicare. You cannot go into the Medicare program that you have today. Okay? Premium support. Well, where do people think what's the idea behind premium support? It means as premiums go up, you get support. This doesn't have that. Federal employees get it. You get it. Look, I want everybody to look. This has been a fact check. Let me just read something. It got a false. David, under the federal...
Tom.
I'm sorry, Tom.
David's your guy.
Sorry, Tom. It's been... I'm sorry, Tom. I apologize, actually. It's been a busy couple days. But, Tom, let me... Okay. Under the federal health benefit plan, the one that you and I and everyone in this room is on, there's what's called the fair share formula. That means that the employer, in this case the federal government, pays a fixed share of the premium. So as the premium goes up, the risk to the beneficiary is fixed. That's premium support. Premium goes up, the support for the premium goes up. The whole way this plan makes money is to break the idea of premium support. That is the fundamental idea behind that. Yes, it is, because it's true. Because as premiums will go up, their premiums are projected to go way up, and the support the seniors will go up at a teeny little rate. And the money in this bill, the savings, is because you're transferring that risk. That is just a reality. You've got to read your own bill.
Chris, as you know,
that's how it works.
Is provide more resources for those who are sicker and more resources for those who are less well off.
How do you do that? You took $700 billion out of Medicaid.
More resources.
How do you need more resources? That's how you get it. That's why it's unbalanced.
The system. The current system is going to go broke in 9 years. Medicare trustees themselves said it.
Dr. Price, giving more support for people sick, if you give them an extra dollar on something that costs them $500, they're going to have to drop that that whole insurance bill. I don't think we've taken into consideration what will happen in the United States when all these sick people are off Medicare and on whatever it is that we have to give them, because we're certainly not going to let people be dying in streets, I hope. But one other point I'm making, then I'm through here. I wanted to talk about, I understand the fact that we talked about 2008 and how we were taken completely by surprise. We're taken completely by surprise because the regulators did not regulate. I think that certainly nobody's going to argue that.
You're absolutely right.
And we tried our best to remedy that with Dodd-Frank,
which
was not a perfect bill, and I think Dodd-Frank would tell you that. But why are you in this bill doing away with some of the consumer protections and some of the things that could avoid another awful bank failure like we went through?
Because I think if one's objective about evaluating the Dodd-Frank, that they'll appreciate that what it does is ensure that we continue the bailout mentality and the bailout processes that are here in the federal government, that we increase the regulatory scheme so that it actually decreases the ability of the market to work. They don't provide any greater flexibility for the folks who are...
It increases the regulatory scheme so that...
So that there isn't the kind of ability for the regulators to actually respond to new products out there in the market.
Because there are too many regulators.
No, because again, you didn't empower, the bill didn't empower the regulators to do their job with new products out there in the market. The problem wasn't that there weren't regulators, it's just that they didn't do their job.
Well, that's an interesting play on it.